moving on to finding number 4 of the Kerrey-Danforth Commission. To be effective, any attempt to control long-term entitlement growth must take into account the projected increases in healthcare costs. Now, that is absolutely true, remains true today. Uh, One thing I should say, though, is that this is kind of a good news finding. There has been good news on this finding. Healthcare costs have not risen as rapidly relative to the size of the economy as was projected back in 1994. There has been a slowing of the growth of healthcare costs. Now, healthcare spending goes up because of increased numbers of beneficiaries. You're going to have more, certainly have more beneficiaries for Medicare and Medicaid than you did in 1994. And that's certainly reflected in the long-term projections. But the extent to which healthcare costs have grown faster than the economy is really kind of an interesting phenomenon. They have actually slowed, and nobody's quite sure why. We've speculated on this. Steve, I mean, what are some of the reasons for this slowdown in healthcare costs?
Well, yeah. I mean, we've had an interesting phenomenon. I mean, to put it into sort of broad perspective, before Medicare and Medicaid were enacted in 1965, so you just go back to say 1960, we were spending basically 5% of GDP, 5% of our economy on total national health expenditure. That's public and private spending overall, 5%. So fast forward, we create Medicare, Medicaid, we create the Affordable Care Act. Fast forward to today, we're spending 17, 18% of GDP. So clearly, healthcare spending overall has gone up. And so if you look at it from 1960 to today, you can say, wow, look at this increase. But the interesting thing, as you just noted, there have been a couple of periods where just, to the surprise of almost everyone, the healthcare cost slowed down. And notably during the 1990s, there was a period of almost 10 years from early 1990 through the end of that decade where healthcare spending basically remained at the same share or the same level of GDP. It was about a little less than 14%, and it stayed sort of flat, stuck there. Some people attribute that there was a big push. Of course, that was when President Clinton proposed to reform the healthcare system, and there was a big push toward managed care. And HMOs and provider networks, and there were lots of cost containment efforts that were done during that period. And it's hard to know how much credit to give to those efforts for the slowdown in the rate of increase in healthcare spending. But there's some reason to believe that maybe contributed to the slowdown. After the 1990s came to an end, national healthcare spending began to grow again. It went from less than 14 up to almost 16%. And then once again, surprisingly, in the early 2010s, healthcare spending slowed down again. And so you had another period from roughly 2010 until the pandemic hit, where again, healthcare spending remained roughly flat as a share of the economy. And it's not quite clear why that happened. And of course, then the pandemic hit. Obviously, that did two things because we're comparing spending to GDP. GDP fell because of all the closures of the economy and the effects of COVID. And so healthcare spending rose as a share of the economy because the economy was falling to a large extent. But then since the pandemic has come to an end, healthcare spending has declined from that COVID peak of about almost 20%. It's now back down to the 17% or so that it was prior to COVID. And so once again, we've seen for almost a decade and a half, excluding COVID, where healthcare spending has not been growing faster than the economy. And it's anybody's guess whether that will continue. And of course, the official estimators, the Congressional Budget Office and the Center for Medicare and Medicaid Services in the administration, they're all assuming, both because of the demographic shift and just the historical rise in healthcare costs, that will continue to grow in the future, and we'll see healthcare spending continue to rise as a share of the economy and as a share of the federal budget.